Welcome to RAAONLINE. Myself Dr. Nishantini, Assistant Professor of Pharmacology. So today's class is regarding adverse drug reactions and pharmacovigilance. So this is one of the most important topic in general pharmacology. Learning objectives of this session. So at the end of this class or this session, you should able to tell what do you mean by adverse drug reaction, what are the important types of adverse drug reactions and its severity. Then you should also know about what are the different categories of ADR, that is adverse drug reactions. And finally, the most important topic, what do you mean by pharmacovigilance and what is the importance of pharmacovigilance in our country. Adverse drug reactions. What do you mean by adverse drug reaction? So, any undesirable or unintended consequence of a drug administration is called adverse drug reaction. That is, any unwanted, unavoidable effects due to a drug is called adverse drug reaction. The WHO, that is the World Health Organization, has given a definition for this adverse drug reaction. Let us see what is that. So, any noxious change which is suspected to be due to a drug occurs at doses normally used in man, requires treatment or decrease in the dose or indicates caution in the future use of the same drug. So, this is the exact definition of the adverse drug reaction given by WHO. So, you need to remember here any noxious change which you suspect because of the drug is called a adverse drug reaction. Okay. So, now let us see what are the different types of adverse drug reaction. See, there are two major important types of adverse drug reaction. What are they? Type A, otherwise called as predictable. Other name for this is augmented. So, predictable adverse drug reaction is otherwise called as type A reaction or augmented type of adverse drug reaction. What is the second important one is unpredictable adverse drug reaction, which is otherwise called as type B reaction or bizarre reaction. So, as the name suggests, the predictable reactions can be predicted by the clinician. Okay. So, this occurs because of the augmented pharmacological properties of a drug. That means, which occurs due to the increased pharmacological properties. So, all these predictable adverse drug reaction occurs because of the pharmacological properties of a particular drug. Okay. So, side effect, toxic effect and drug withdrawal effects are some of the categories of the adverse drug reaction which comes under this predictable adverse drug reaction. So, this is common type of adverse drug reaction when compared to other types of adverse drug reaction, and this is always dose related and it is reversible. That means, if you stop the drug, the adverse drug reaction gets automatically reversed. Next one is unpredictable adverse drug reaction. It is not known action of the drug. That is, this reaction, why it is happening, we do not know. So, idiosyncrasy, allergy or different categories of adverse drug reactions which comes under this unpredictable or bizarre kind of adverse drug reaction. So, it is very less common and it is not related to dose. That means, even if you give a small dose, it triggers the reaction in individuals, some individuals. So, most of these unpredictable reactions are very serious that may lead to lethality. Okay. So, it needs a immediate withdrawal of a drug. Next, we will see about the severity of the adverse drug reaction or grading. So, how you are going to grade the adverse drug reaction? First one is minor, next moderate, severe and then lethal. So, what do you mean by minor adverse drug reaction? That means the adverse drug reactions are very mild which does not require any kind of treatment. Moderate means that requires a change in treatment. That is, you need to change the drug in order to reverse the adverse drug reaction. Sometimes it may lead to the prolongation of the hospital stay of the patient. Next one is severe. Severe means it is a potentially life-threatening reactions which leads to permanent damage. That means permanent organ damage like liver damage, kidney damage can occur to the patient. Okay. So, these patients needs a intensive medical treatment. Then final one is lethal. So, lethal, as the name suggests, the drug directly or indirectly contributes to the death of the patient. Okay, so these are the severity of the adverse drug reaction. Now let us see the different kinds of adverse drug reactions. There are 12 different kinds of adverse drug reactions. So let us see one by one in detail. First one is the side effect. So this is one of the commonest category of the adverse drug reaction. So the clinician encounter this kind of side effects in their day-to-day life. So the definition for side effect is any unwanted and unavoidable pharmacodynamic effects of the drug which occurs in the individual at therapeutic doses. So note here, these side effects occurs only at therapeutic doses in some individuals. So if you reduce the dose, the amelioration of the symptoms occurs, that is the symptoms started to reduce. If you reduce the dose, the symptoms started to reduce. This kind of adverse effects, that is the side effects, can occur based on different mechanisms. Okay, so first one is, so this side effect can be occur based on the same action as therapeutic effect. So let me explain with an example. So atropine produces dry mouth used as a pre-anesthetic agent. See, atropine is an anticholinergic drug which is used as a pre-anesthetic medication in order to reduce the secretion. Okay, so it is having an anti-secretory property. So this anti-secretory property of atropine is responsible for dry mouth. So this dry mouth is considered as a side effect of atropine. Second one is based on the different facet of the action. So let me explain this with an example. So promethazine causes sedation. What is a promethazine? So promethazine is an antihistamine drug which is used to treat allergic conditions. Okay, so it causes sedation which is considered as the side effects of promethazine. Sometimes the drug acts as a therapeutic agent in one context, but at the same time it is side effect in another context. Example is codeine. Codeine is an opioid used as an antitussive agent. Antitussive means it is a cough suppressant. Okay, so it produces constipation which is the side effect of codeine. Sometimes this is useful in treating the traveler's diarrhea. Okay,